Hello everybody, my name is Dr. Kira, and welcome back to Surgery Squad. Now, we're going to go down a bit of a memory lane for most of us, myself included. One of two surgeries today is braces. Guys, I'm not even going to lie, I had braces, but the wire kept scratching the inside of my cheek, and I'm like, okay, you know what, screw this. So I took a pair of tweezers, right, and just yanked out the cord. Oh my god, that hurt like a bitch. Yeah. So I never finished the braces procedure. But let's jump right on into it, shall we? And while we wait for the loading screen, in other news, I beat the Elite Four in Kalos today. So, fun times all around, yeah? Something in my eye. Why is it that whenever I start recording, shit gets in my eye? Literally, every time I start recording.
Welcome to Surgery Squad. I'm Dr. Jeff, and today we're going to talk about braces, those fantastic bands and wires that help straighten out crooked teeth. Let's face it, most of us do not have perfect teeth. Everyone's smile is unique. Some people's teeth are just a little more out of shape than others. Your teeth might be crooked, or your upper and lower jaws might not be the same size. If your upper jaw is bigger than your lower jaw, that is called an overbite. If your lower jaw is bigger than your upper jaw, you have an underbite.
Yeah, I got an
Sometimes
underbite.
your mouth is not large enough for all your teeth. That is referred to as overcrowding. In all of these cases, the problem can be fixed with braces. Braces are a series of brackets, wires, and bands that are used to guide your teeth back into the correct position.
I did that a little too well, didn't I?
This improves looks, makes it easier to chew, and at times even improves speech. Our patient today has what looks to be an overbite. We want to see how noticeable it is. We'll start by getting a record of the current state of her teeth in many ways, including x-rays, impressions, and photographs. We'll start by taking some x-rays.
Jeff, I'm not even going to lie, man. You're bringing up some bad memories for me. Okay.
Next, we'll take an impression of the teeth. We put a special gel on the bite mold. The gel comes in lots of terrific flavors, like candy cane and chocolate cake. Can you put the mold in the mouth?
Yeah, I actually remember this. What they did for me was, when they gave me the mold, was, and you can actually personally request flavors. For me, I requested bubblegum. So I had like this neon pink molding in my mouth, and it stained my teeth pink for like a week. Don't let anybody fool you, kids. Braces suck.
Great job! We'll have my assistant make the bottom impression. Once we have them both, we'll use the impressions to make a plaster model of the patient's teeth. Okay, we've got our impressions and x-rays, and we can see that our patient needs braces. I've also taken some photos for our before and after wall. We'll arrange an appointment for next week to put the braces in place. Our patient is back, and we're ready to put on the braces. In some cases, a patient may need spacers placed between the teeth for a week to create more room for the bands. Our patient does not. We'll start by polishing all the teeth. Making sure there is no debris on the teeth will ensure that the braces adhere better. Run the polisher over the teeth to clean them.
Okay, so this is... Okay, that's bringing up very unpleasant memories. Ooh. Okay, Come on. What happened? There we go. Yeah, they run this thing through your mouth, and against your teeth, it feels like someone's using an electric sander. Okay. Yeah, this thing, I shit you not, guys. From personal experience, this thing feels like an electric sander being rubbed across your teeth. I think I got everything, didn't I? Okay.
Wow, what a marvelous job. I can almost see myself in those teeth. We need to put on some molar bands to anchor the braces. They circle the whole tooth and have a hook on the outside of the tooth. Slip the molar band over the tooth. We'll cement it into place later.
Huh. I heard something. Yeah, what they do is after I'm actually surprised with how accurate this is. They run that thing across your teeth, and then they stick these little suckers on onto your molars in the back, like right in this general area. And these things, putting them on,
Great.
the most
Now we can start putting the
uncomfortable
bonded
shit in the
brackets
world.
on the rest of the teeth. We've placed a lip guard over the teeth to give us room to work. Let's rinse off the teeth. Can you spray them with water? I run the suction to remove the water.
The first time I did this, guys, I gagged. I thought I was going to drown for a second. Yeah, what they did for me was, instead of on the teeth like I'm doing, what they did was they poured it down my throat, and my gag reflex kicked in. My gag reflex is actually crap as is. So when the water hit the back of my throat, I started coughing right there in the chair.
Let's spray some air to get the teeth nice and dry. Can you handle that for me?
What the hell's the matter with you, you lazy bitch? Oh, I guess since we are the player, you know?
With the teeth dry, we'll now put a small amount of bonding agent on the teeth. Wipe a little bonder on each one.
Ugh. Bad memories, man. This stuff is basically a glue, you guys, so that the brackets will stay on your teeth. Not fun. I honestly cannot wait to get this surgery over with so that we can move on to the next one. You can't see it because I've got just what you see on the screen here, but up here I actually have another tab open for our second surgery, so which is why I'm kind of anxious to get this out of the way. Okay, there we go.
We let the bonder dry for a minute or two so that it is sticky. Then we place a bonded bracket onto it.
Oh yeah, these things were a hell of a lot of fun to have put on your teeth. Literally the only upside to this, ladies and gentlemen, is that when you get these on, they let you pick out different colors. And when I had them, I had just been introduced to Shadow the Hedgehog. So all you saw was like black and red across my teeth.
I will scrape off the excess bonding agent with a dental pick. Now use a curing light to harden the bonding agent under the brackets. Click to turn on the curing light.
Okay. Plus, these
Great
things-
job. Now I'll put the bonded brackets on the rest of the teeth. There we are. While I was at it, I readjusted the molar bands and cemented them. We're ready to place the arch wires. The arch wire is a thin wire that connects all of the teeth by going through each bracket. Let's slip the wire into the brackets of the bands on the molars. Move the wire to the mouth to put it in place.
Okay, another shit side of these, ladies and gentlemen, is that if you don't have insurance, these things can run you a ballpark of $1,400, I think it was. Yeah, not cheap. Okay, now get in there. Oh yeah, bullshit. It was not that easy when I did it. Alright, so.
Good job. We do not want the wires to poke our patient, so now that they are all snapped into place,
then what the hell
I'll
happened with
reduce
me?
the ends by clipping them off with pliers. And there we are. The arch wire is in place. Now we'll use elastic ligatures to make sure the arch wire does not fall out of the band. The ligatures are little rubber bands we snap over the front of the bonded bracket using a different pair of dental pliers. Now you try. Place the ligature over the brackets indicated.
Okay. Like I said, I had to go through this when I was a kid. Not fun. Yeah. Yeesh. Yeah, you can tell I'm anxious to get this over with.
And with the last ligature in place, our patient is done for today. In the next few days, she might experience some initial discomfort. She should plan on eating soft foods and taking over-the-counter pain relievers if needed. Orthodontic wax can also relieve discomfort. If there is a real problem, she can always call the orthodontist. It is important to take more time brushing and flossing when you have braces, as food can get lodged between the wires and the teeth.
I despise
Our patient will have regular
so
appointments
much.
about once a month for the next 6 months, and then space them out after that. The treatment usually takes about 1 year with braces, and then additional time with a retainer. The true length will vary by patient. She might also need additional equipment such as elastic bands, coil springs, or headgear. We will not know until we see how she responds to the braces. There you have it. The braces are in place, and our patient is on the way to a beautiful straight smile. Thanks for coming by Surgery Squad. Why not check out one of our other procedures here on SurgerySquad.com?
Okay, now that that's over with, we can advance to the next surgery. So, let me close this out, be done with it for good, thank God, and then we can advance to the next surgery, which is childbirth with epidural. So, give me 1 second, let me open the other tab back up, and I will see you guys in a sec. Okay, everybody. Now, I know that I said in the last one that childbirth with epidural was the next surgery I was going to do, but and I was actually playing it through it and recording it, but I myself deemed that I would not be able to show it on YouTube. I mean, yeah, it's a medical game, but YouTube is really uppity with their mature content filters. So I decided to play it safe, get rid of that footage, and now instead we're going to go for a root canal. So let's get started, shall we? See, the childbirth normal, well, back with epidural, and then a normal childbirth, but I didn't think I could show it on YouTube.
Welcome to Surgery Squad's virtual root canal procedure. I'm the one and only Dr. Jeff, and I'll be helping you with this surgery today.
Jeff, did you get a voice
A
change?
root canal is an endodontic dental procedure that's used to repair and save a decayed or infected tooth. During a root canal, your dentist or endodontist will remove the pulp tissue within the tooth. Once everything is removed, they'll clean out any contaminants inside the tooth and seal it to prevent any further infection. Our patient today is having a root canal performed on their lower right second premolar. A dental professional may refer to this tooth as tooth 29. Before we begin, would you like to review some of the common myths and misconceptions surrounding root canal treatment?
Now, before I do that, back to what I was saying earlier. It was a fairly normal, childbirth. Stick them in the back with epidural, and then just a regular childbirth. But I wasn't aware if I could show that or not on YouTube. I'll try and find someone to talk to who knows YouTube and see if I can upload that. If I can, then I will do it again and actually the footage. But if not, then I'm just going to avoid that surgery like the plague. And now, don't get me wrong, guys. This isn't me saying, this isn't, cure women. I don't at all. So don't go there, Tumblr. So, yeah, it's just me playing it safe. It's just me protecting my own ass. So, would you like to review some of the common myths and misconceptions surrounding root canals? Yeah.
I thought so.
Okay. During a root canal treatment, the tooth's roots are removed.
Not even close. Remember, a root canal only involves cleaning, disinfecting, and sealing off the inside of the tooth. If the tooth's roots were removed, it would no longer have anything to anchor it to your jawbone.
If a tooth doesn't hurt, it doesn't need root canal treatment.
Not true at all. It is very possible for a patient to require root canal treatment if they have never experienced pain from a tooth. This is why having routine dental exams is important.
Pulling the tooth is a better option than having a root canal.
Often patients may choose to have a tooth removed instead of having a root canal. While this may immediately seem like a simpler and more economical choice, it's often the opposite. Having a tooth extracted and replaced with a bridge, implant, or removable partial denture is not only a more costly option, but it also requires more treatment time.
Teeth that go through root canal treatment are eventually lost or pulled.
Not exactly. With positive oral hygiene habits such as routine brushing, flossing, and dental cleanings, most teeth that have root canal treatments can last your entire life.
Root canal treatments require multiple appointments to complete. I hope you guys are learning as much as from the Surgery Squad series as I am, because I'm actually learning a lot. I didn't think I would. I thought, okay, I saw Jacksepticeye play, and I thought, okay, it's just a fun game that you lets you play doctor. No, actually, when I started, I actually was learning a lot. So, root canal treatment require multiple appointments to complete.
There is some truth to this statement. The number of appointments that are required to complete your root canal treatment depends on a few variables. These include how your dentist has been trained, their experience, equipment available to them, and the condition of your tooth.
Okay, okay. Click next to begin the surgery. Okay.
Let's move on. In effort to make our patient as comfortable as possible, we need to inject a local anesthetic into their gum line. But first, apply a topical numbing gel to the injection site. Okay. This will help reduce any discomfort the needle may cause.
Alright, scrub that down.
Into the patient's gums. Just below the tooth we'll be performing a root canal treatment on.
Now, hold on, guys. I'm actually going to raise the bullshit flag, and if the developers are watching, You see this here? And this here? I always thought that in order for, any kind of surgery, be it arms, head, that you have to be completely clean shaven. For example, if you're going to brain surgery, they shave off all your hair so that no hair gets into the skull, and then it gets in what I'm trying to say. Okay.
Let's give our patient a few minutes to relax and for their mouth to become completely numb.
Yeah, all right.
Now that the patient's mouth is numb, we can move on to isolating the tooth. Since our patient's saliva contains contaminants that we don't want getting into the tooth, isolation is a critical step during root canal treatment. To isolate the tooth, we need to punch a small hole into the rubber dental dam and place it over the tooth.
Is anybody else noticing this, or does this guy look kind of like the default Commander Shepard with a little lighter skin?
Once the rubber dam is in place, put on a tooth clamp to keep it from moving.
All right.
Next, we'll need to dry out the tooth as much as possible using our air-water syringe. Now the tooth has been isolated, we can create our access cavity in the tooth using our drill.
Drill? Okay. Okay. I'm not noping out on the game. It's just, I'm noping out on this. In real life, if I ever go for a poop, someone will kill me. Or if I ever have to keep pulled, of course, kill me before I go through that. Ooh.
The next step is to clean and shape the tooth's canal using a root canal file. And give it a shot.
Okay. Oh my god, man. Well, I mean, it's not really
At
as
this
bad
point,
as,
the dentist would measure the depth of the canal
the-
using a combination of x-rays and specialized equipment. If a dentist fails to measure properly, it could mean that the tooth would be at risk for reinfection. Now we need to clean the canal of the tooth using sodium hypochlorite, commonly known as bleach.
Wait, you use bleach to clean out the tooth? Like bleach, like what you use to do your laundry with. Okay, so tooth and get it going. As I was trying to say, it's not this surgery.
We'll let the bleach sit in our patient's tooth for about 5 minutes to make sure that all the bacteria and tissue inside the tooth has been dissolved.
Now, as I was saying...
Great. Now use the suction to remove the bleach from the patient's tooth.
Jeff, I'm about to mute you. As I was trying to say, the surgery isn't nearly as bad as the ingrown toenail surgery. So, I'm surprised that they for the laundry whites.
We'll need to fill the tooth using a rubber compound known as gutta percha. Gutta percha is often preformed as tiny, thin cones that we'll insert into the clean canal of the tooth. I've already added some sealant to the gutta percha cone. Let's see what you can do.
Okay. That looks like a match.
Looking good. A heated instrument is now used to remove the excess gutta percha.
I swear, that looks like a match, though.
Pack the gutta percha into the tooth canal using a plugger.
Alright.
After the gutta percha has been placed, it is common that additional x-rays are taken to verify that the canal has been adequately sealed off. Once the dentist verifies that the canal has been sealed, a filling or crown is placed, depending on the location of the tooth. You can learn more about fillings and crowns in our virtual dental filling and virtual dental crown procedures here on SurgerySquad.com.
Okay, guys.
After a root canal, patients should expect some mild sensitivity and discomfort. This can usually be relieved using over-the-counter pain medication, such as ibuprofen or naproxen. By brushing twice a day, flossing daily, scheduling regular dental visits, and avoiding smoking, it is possible to greatly reduce the need for a root canal. And that's a root canal. Why not check out some of our other amazing surgeries here on SurgerySquad.com.
Okay. Now, okay guys, that was braces and root canal. Now again, going back to the childbirth one, I'll talk to someone who knows YouTube better than I, and if I can show the childbirth with epidural surgery, then I will go ahead and record that and upload it for you guys. If not, then I'm just leaving it be. So, next time guys, if you liked this video, slap the like button in the face, and I will see you guys in the next video. Bye-bye!